This week marked the fourth anniversary since the head of the World Health Organization declared the global COVID outbreak as a pandemic. For many Canadians, this was a moment in time that won't be forgotten and one that changed our lives forever. Overall, more than 58,000 Canadians have died from COVID 19, but more recently, both hospitalizations and deaths have dramatically decreased. And with the pandemic largely behind us, there is a lot to reflect on. Joining us now for a look back on the pandemic is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, thank you for joining us.
Great to be here, Joey.
So, like I said, it's been 4 years since the start of the pandemic. Were we prepared as a country for a pandemic? And how do we prepare for the country for the next one?
Right. We should start by saying that no one expected any of this. So the severity, the frequency, the longevity of the pandemic was just unrelenting. Looking back, hindsight is always 2020. Looking back at what we did, I think we do have to acknowledge that we did have some existing pandemic preparedness measures, but I think our issue here was we faced challenges in really scaling those up with those responses. A lot of that was because we have a very decentralized nature of our healthcare system. A lot of it is jurisdictional and provincial. So that really highlighted the need for us to be more coordinated and have a more standardized approach. So moving forward, looking at future pandemics, I think investing a lot more in an integrated and adapted healthcare infrastructure will be much more helpful for the next time.
So, you mentioned that. But what were some of the biggest policy failures besides that of the pandemic?
I think with policy responses, we faced a lot of challenges. I think there were delays in really giving widespread testing, and that caused a lot of issues initially. We also had quite a few inconsistencies with public health messaging, and this was because we had very different guidelines all across the provinces. And there were also a few punitive measures for public health that we did see quite a few measures coming around when it came to even traveling or walking within a city in some provinces and also internationally there.
And what were some of our policy successes? Do we have any?
Well, the numbers don't lie. Just comparing to many countries, we did quite well with our own vaccination and also looking at the death rates. As of today, we have close to about 5 million cases in total of COVID-19. And as you said, less than 60,000 deaths. Now, even one death is too many, but given with what we were dealing with, we definitely came through quite well as a country. I think our biggest success was securing a diverse portfolio of vaccines for our citizens, even though we really didn't have any capacity of creating the vaccines ourselves. So I think that's a big achievement that we had.
Some commentators have said that recent increases in overall vaccine hesitancy stem from how political vaccination became during the pandemic. What do you make of that argument?
Well, I think political leaning, can frequently be linked to particular values and ideologies. But for me, I see that vaccine hesitancy, again, just comes into three categories. We have a lack of confidence in the system or policymakers, a lack of complacency, so thinking that you don't really need it, and a lack of convenience in the availability of vaccination services. So addressing those three would really help bringing down any future vaccine hesitancy that we would have.
And as a medical professional yourself, how has the medical field changed as a result of the pandemic?
Well, the medical field essentially has gone through hell and
Mm.
back during the pandemic. We've seen an exponential increase in burnout among doctors, and our own healthcare system seems consistently on the brink of collapse. But I think what we've seen as well is a lot of innovation to deal with that there. We've seen a big change in the adoption of telemedicine, which has really played such a pivotal role in maintaining access and services, especially in remote and underserviced areas in Canada. Another highlight has been that the pandemic has really brought our healthcare system to be more adaptable and more working together with other global initiatives. So our scientific knowledge is not more isolated in Canada anymore. We tend to work together in groups across several countries now.
That is great. Is there anything else you think that could really help the medical community in 30 seconds as far as staff and doctors for preparing for something like this again?
I think it's important to keep in mind that we have two groups. We've got our doctors and staff, and we also have our citizens as well. And having those measures in place that will help support doctors, but also help our citizens make good decisions is critical. And basically, it would be a public health effort in education.
Thank you so much for your time.
Thanks so much for having me.